Hi and welcome back. In this lecture, we're going to talk about key insight 2, environmental, social and governance of what we call ESG frameworks and how it applies to the healthcare industry. So if you look at the past, every company's performance, every industry's performance was measured using the bottom line. So basically how profitable a company was. It can include things like companies earning profits, net income or earnings per share or what we call EPS. But now we have moved on to what is called the triple bottom line, which is focusing on three elements, not only profit, but also planet and people as well. So it's basically measuring the impact that a company has on the planet or what we call the environment, and also the people, the communities, the employees, the relationship with suppliers, and all these things are added up to calculate the triple bottom line. But also there's something called ESG, or what we call environmental, social and governance. So there's a lot of discussion when it comes to implementing ESG because that seems to be the way forward along with concepts like the triple bottom line. So ESG focuses on three main components, which is the environmental component, which is basically focusing on the company's environmental impact. So in this case, things like carbon footprint, how it manages waste, how it processes waste, managing byproducts, pollution and all these factors. Then when it comes to social aspect, it focuses on things like ensuring universal basic human rights within the workplace and the work environment, and also eliminating child labor and ensuring high levels of occupational health and safety, or what we call OHS standards in the workplace and factors like that. Then there's a third component, which is the governance component, which focuses on ensuring that the right frameworks are in place. So things like anti-corruption, anti-money laundering, transparency, accountability, traceability, and all these things to ensure that the company is governed properly. So ESG ratings are basically measuring a company's exposure to long-term environmental, social and governance risk and its implications. So how does it apply to the healthcare industry? Well, if you look at the first factor, which is the environmental factor, there are certain criteria like carbon neutrality or negativity. So what's the carbon negativity or carbon neutrality targets of the particular healthcare provider? So concepts like how are they obtaining the energy, whether it's from renewable sources or from fossil fuels, and also what about the logistical networks? Are they using renewables? Are they using electric vehicles or hydrogen-based vehicles, and other similar factors? Then there's the advanced waste management. So this focuses on how hospitals and other healthcare facilities dispose waste. So all of us know that hospitals and other healthcare providers use a lot of single-use plastics, whether it can be syringes, gloves, personal protection equipment, and all these things. And these things cannot be used twice because of contamination issues. So what is the waste management policy? How is a hospital or healthcare provider addressing this? Whether it's recycled or whether it's broken down to fundamental elements and repurposed, is it being treated in a very sanitized environment? So for example, if you look at the SARS-CoV-2 virus, which caused the COVID-19 pandemic, unless you dispose the waste material properly, people who are handling the waste can get cross-contaminated and then they can get infected as well. So there are very high risks when it comes to disposing healthcare-related equipment and resources. Then we have things like usage of resources and its environmental impact. So things like the usage of water, is the water recycled? What about things like water treatment and sewage treatment? So for example, if you look at things like watering the plants, within the healthcare facility are concepts like rainwater harvesting, where you get the rainwater, store it and then use it to water the plants and things like that. Are those concepts implemented and practiced? Then we have things like pollution management. So that includes things like air pollution, noise pollution, land pollution, and water pollution. So each of these areas must be managed in a scientific manner. So are we disposing the wastewater properly? Are we managing the land properly? What about water resource utilization and management? What about air pollution? Are we emitting toxic fumes to the environment? So can we add some kind of filter to remove the toxins from the fumes? So that kind of a thing must be practiced. Then we have the S, or the social aspect. So things like enforcing universal human rights. So things like enabling universal healthcare. Is there some kind of anti-discrimination policy, not just only for patients, but also within the internal staff or healthcare professionals? What about the contribution of the healthcare provider to societal needs? So is the provider focusing on actually alleviating human suffering and making people's lives better, or just making profits? So basically the motive of the healthcare provider, whether they're walking the talk, whether they live up to the values, principles and ethics that they believe in, and other similar factors. Then we have things like increased standards of occupational health and safety. So are the healthcare professionals well equipped to handle any kind of scenario? For example, things like biohazards and this whole COVID-19 pandemic. Are the personal protection equipment available? Are the employees given adequate rest? Or are they feeling demotivated and burnt out? What about their morale and job satisfaction? So all these factors must be considered. Then another factor is investing in the technology to improve the security, efficiency and productivity. So is the healthcare provider actually investing in technology to make lives better, both for patients and their own employees? So things like using automation to automate tasks which are repetitive and mundane, and also focusing on cybersecurity as well to protect the patient data and other types of sensitive information, and also investing in the right tools to improve the productivity of the workforce. So things like automated work schedule planning and other tools that we can use to improve the productivity within the working environment. Then there are other factors like improving in diversity, equity, inclusion, and belongingness. So are we improving the diversity and equity, giving equal opportunity for everyone with different genders, different castes, creed, religion, skin color, and having a level of community support for everyone where they can speak out about their issues and challenges and also receive comfort and love within the working environment. Then we come to the final factor, which is G for governance. So this focuses on different factors like the diversity of the management team or the board, and whether the business is incorporating strong business ethics. So things like ensuring the high quality delivery of medicines and ensuring that patients' lives are saved and no compromise is done. So for example, things like finding shortcuts to import medication, importing poor quality medication, not taking adequate precautions when it comes to doing things like surgeries, poor planning, and all these things must be avoided to ensure that strong levels of business ethics are practiced. Then we have things like strong corporate governance frameworks. So are we having the right governance frameworks? So are we having the right protocols, the standard operating procedures so that employees can't mess around with things like patient data, and the number of avoidable errors are brought significantly to a very low level? And also there's strong responsibility and accountability framework, meaning if something goes wrong, people are held accountable for their actions. Then we have other factors like zero tolerance policy for corruption and fraud. So are transparent procedures being followed when getting quotations from suppliers, when ordering medicine, when ordering different tools? Is the process transparent and audited? So those kind of factors. And finally, we have frameworks for measuring and monitoring ESG metrics. So we can't monitor what we can't measure. So do we have the right metrics to measure and monitor the ESG performance? Does it align with the ESG strategy? Are all the business functions aligned together to achieve the ESG goals? So all these factors must be considered in detail. Well, that's about it for environmental, social, and governance, or what we call ESG frameworks in the healthcare industry. I'll see you on another lecture.